Hi there, my name is Dr. Steven Shoshany, and today I'm talking about the brand new table that I got. It's Cox Force Table. What makes this table unique is it's a Cox table that has transducers built into the table. What that does is it measures different forces. It measures my hand force, it measures how long the table distracts, at what angle it flexes. So it gives me an ability to track how the patient is going through treatment. The Cox technique is a chiropractic technique that's designed by Dr. James Cox, who is, in my opinion, one of the leaders in the chiropractic profession when it comes to non-invasive care of patients with disc problems, specifically cervical and lumbar discs. I've been utilizing the Cox technique since 2008. What I like about it is it allows me to treat patients that I would normally not be able to treat with traditional chiropractic care, or if we did, it would probably make them a little bit worse. What's nice about it is we can take patients that have facet syndrome, have really bad disc herniations, disc extrusions, whether it be cervical or lumbar, tremendous cases of sciatica that have not responded to surgery, and we could help them in a very short period of time. And what transducers do is they measure force. And there's multiple transducers in the table. So that's what makes it so unique, is it gives me visual feedback live, real time, what I'm doing to the patient when they're laying on the table. So things like y-axis force can be measured and graphed out, so it could show me how far the disc is decompressed or how far that segment is unloaded. The next would be the thoracic force, how much force I'm using on my one hand. Y-axis force is how much force I'm pushing that way. Hand force is how much force I'm using on my hand, and the flexion angle is how much the table is flexing. It gives me a tremendous amount of feedback so I can make the treatments consistent, and anyone that's working here in my office can also follow and be very consistent, so the patient treatment isn't staggered, it's pretty steady. So what's nice about this, it gives me a lot of very objective information so we could show patients the progression of their care. So this table handles both flexion, distraction of the lumbar spine and of the cervical spine, and it's very comfortable. As you saw earlier, when patients are on a table, they melt into the table, and it allows me to very safely unload their spine, take pressure off the spinal nerves, and help their discs.